Josie Hughes was diagnosed with breast cancer 2 years ago. Upon receiving the news, her doctor then suggested she has to go for a mastectomy. Hearing the word mastectomy, she thought her world was closing in on her.
Well, I remember I was at work that day, and I'm a nurse, so I was sitting at the counter, and the doctor came and he stopped at the counter and said, I have your results. And before he actually told me the results, I could see on his face what the outcome of the result is. So nobody's prepared for that result. So emotionally, for that few seconds I was okay, but later when you're alone, then it kicks in and then you realize what the doctor has told you about your results.
But with good support structure, Josie was then advised to go for second opinion, as she was very skeptical opting for a mastectomy.
Well, because you get this news and you hear you have to get a mastectomy, at that stage you think it's the best thing. Because you think if you have the mastectomy, then the cancer is gone. But you don't have all the info. If you have all the info, then you realize, but you don't need the mastectomy. So I was given the option to decide, do I want the mastectomy? And the doctor said, go home and think about it. So luckily that night, I've heard that there is other options.
Dr. Alvin Castens points out that mastectomy should never be the first option given to patients who've discovered they have breast cancer or those who have a family history of the condition.
The fact is there is no proof and there is no study that ever showed on earth that a woman lives longer after she had a mastectomy. And even less so when you take off her normal breast, the opposite breast, right? So, for instance, now, recently in the press, less invasive treatment is associated with improved survival in early stage breast cancer. That is published now in Cancer. You know, it comes from large institutions like the Duke University and Cancer Center, where they, for instance, in this case, they have now taken 112,000 people in their files with breast cancer, divide them in the mastectomy group and the non-mastectomy group. And there was a better survival for women who had smaller and lesser surgery than the women who had a mastectomy. So where does it come from that you've got on front pages of popular magazines, you've got mastectomy? So there's no proof that mastectomy will let you live longer. In fact, now, dangerous thing is happening here, and that is these institutions show that people even die earlier of the mastectomy, instead of doing smaller and lesser surgical intervention.
Dr. Castens furthermore adds that hormone replacement therapy is one of the most leading causes of breast cancer in the world.
The women should be empowered by knowledge, you know, and one of the things that I tell women, listen, what you do from your young age, what you drink, if you're using the pill, you increase your risk for breast cancer in 20 years. If you use hormone replacement therapy, you're causing breast cancer. And if you stop that, you can actually prevent breast cancer. This is very well documented. There is no argument about this.
According to recent health statistics for South Africa, 1 in every 29 women will be diagnosed with breast cancer. With these shocking stats, Josie advises women to take precautionary measures.
I know the trend in the world is, I don't know, I think it's to start at 40 years to have your first mammogram. But I told myself, with all the changes in the world, all the wrong hormones we take in, all the things that's affecting our bodies, we cannot start at 40 years anymore. So I told myself, start at 35. And I said to myself, if nothing is wrong, I'll go at 40. So you can have the same attitude.
The advice to women with a breast problem, say for instance she feels a lump, or she feels uneasy, or she gets a red mark, or the nipple pulls in, or she's got a discharge, she must rather go to a breast cancer or a breast care facility, clinic situation, or a care center, where there are knowledgeable people that specialize, super specialize actually, in breast pathology and breast disease.
Dr. Custance has recently published a book called Beauty and the Breast. It aims at informing women on taking care of themselves. Best of it all, it focuses on the importance of promoting healthy breasts. For more about the book, log on to www.breastcare.co.za. Lerato Manzi, SABC, Pretoria.